Finally, a source of raw, real, and honest information on healthcare issues that matter most. Welcome to BS Free MD. From the latest medical information to how to stay sane as a doctor or a patient, no subject is taboo, no BS is allowed. Now, let's welcome your hosts, Doctors May and Tim Hindmarsh.
Welcome back to another episode of BS Free MD with your two hosts, Doctors Tim and May Hindmarsh, where we like to challenge the status quo and discuss various aspects and all aspects of healthcare and medicine. And today's show, oh boy, if you are really, our guest, we heard him speaking, and I'm just thinking, if you're looking for a better solution to your healthcare program, prepaid medical care, whatever you want to call it, health insurance.
Because it sure as heck is not insurance.
Well, then I'm sure you've heard of all kinds of things out there in the past. Maybe you haven't, and you don't know what other options there are. But some people have researched various things. We had looked into it in the past, and some of it just seemed too restrictive based on our healthcare needs. So we're going to go down that road with an amazing guest today to talk about a new way to cover your healthcare costs that is way less money, puts more money in your pocket, and covers you for pretty much anything that you'd be covered in the big systems.
All right.
Oh, well, I'm going to drop a little hint who we've got on our show.
Andy Schoonover, who is the founder and CEO of CrowdHealth, which is a really interesting, novel way to pay for healthcare. Because let's be perfectly honest, health insurance is not insurance. Insurance is a financial vehicle to protect you from a financial loss. Health insurance is prepaid healthcare, which is why it's so ridiculously expensive. So, Andy, welcome to BS Free MD.
Yes.
We are very stoked to have you here and talk about this because this really irritates me.
Hey, thanks for having me. Good to be here.
Awesome. So why don't we start off with just tell us the story of kind of the backstory. I didn't want to say consummation. The genesis of CrowdHealth. How did this all come about?
Yeah, sure. This is actually my second healthcare company, and I swore after my first one I wasn't going to do it again, just because of how crazy healthcare is. And so I sold my company, and as such, I had Cobra, which for most people on Cobra, they know it's, if you think health insurance is expensive, try Cobra, which is like twice as expensive. And so I think I was paying. You were on that. Yeah. I think
on it.
We were paying like $1,800 a month or something like that for me, my wife, and my two girls. I was like, all right, I'm not doing this anymore. And so I was ignorant, I think, and thought that, healthcare.gov was my only option. And so went on to healthcare.gov, and it went from $1,800 to $1,200. And I was like, all right, well, I guess this is what we pay. And I joke it worked until I had to use it. My little one, who was one at the time, was having recurring ear infections. And so we went to the ear, nose, and throat doctor, who's like, oh, she's got a hole in her eardrum. And so, she needs to get tubes in her ears. Very common procedure. It takes 15 minutes. And there was one place in network that we could go to in Austin where I live. So we went there, and, sure enough, we were in and out of that hospital in under an hour. And we got a bill about a month later, maybe 3 weeks later, that was $8,000 for 15 minutes. I'm just like, wow, like, whew, but this is what health insurance is for. So I didn't really think about it, assuming the health insurance plan was going to pick it up. And little did I know I was going to get another note in the mail, snail mail, funny enough, from my health insurance company saying that it was medically unnecessary and they weren't going to pay for it. And funny enough, my doctor actually pre-authorized the procedure. So what pre-authorized means for people out there, the doctor actually calls the insurance company and says, or doesn't call, provides them with information and says, hey, this is what we're going to do. Are we good? And so anyway, so the insurance plan said, oh, never mind. Just kidding. We're not paying for it. Medically unnecessary. And so I went through 3 rounds of an appeal process. And I think my ENT said, whether this is true or not, I don't know. He said he was fighting with an ophthalmologist internally at the health plan. And so, the ENT is fighting with an ophthalmologist around, whether or not my daughter needed tubes in her ears. And, I lost that battle at the end. They said, no, we're not paying for it. So I had to stroke an $8,000 check to the local hospital, and I was pissed. There's something about, getting screwed personally, but when you screw my kid, that's when I really get ticked. Right. So I called the insurance plan. I was like, I'm done. I'm not doing this. If you're not going to pay for my bills, I'm not paying for your bills. And so we were at that point uninsured. And my wife looked at me and was like, okay, so what do we do now? And I was like, all right, we're going to figure this out. And so, through that process, I learned a lot. One I learned is that, we're not the only ones that gets denied claims. But healthcare.gov denies about it's 17%. So 1 in 6 claims get denied by healthcare.gov plans. So you got a 1 in 6 chance. Where I live in Texas, it's 1 out of every 5. And I was the unlucky one, and it cost me a lot of money. And come to find out that somewhere between 200 and 250,000 families go bankrupt every year due to a health event, even though they have health insurance. So they have health insurance and they're going bankrupt, which is like a tragedy. It's just, an absolute tragedy. So, we lived for a while uninsured and learned a lot, and learned so much that, finally got to a point of saying, I bet you other people are as annoyed with health insurance as me. What if we offer this to a lot of people? And that was kind of the start of CrowdHealth. And we did that. We started back in 2021. And so we've been at this for, a little over 3 years, and it's worked, beautifully.
I was going to jump in, but I didn't want to interrupt you while you're getting through. And because I know, from our side of things, and I don't know if you're going to share about, you were the bad guy that would deny. Oh, yeah. He was on the appeals and referrals.
You're that guy. Were you?
No, I was that guy.
Were you him? Were you him? You cost me $8,000. No, I'm just kidding.
No. Well, the thing is, we would have paid that. Our insurance companies I work for, because we let it go through. We would have seen that was on us, even if we didn't want to pay for it. To not pay for it after the procedure was done, like that's
what I was going to get to.
Ultra slimy.
I was going to say,
and I don't even know if it's legal, but it depends on what your contractual arrangement was with your individual insurance company.
That's what a lot of people would.
Well, it's funny. The thing is now that I've talked to a lot of people who've had the exact same thing happen. They pre-authorize and then they say, no, never mind, disregard. And for us, there's like really no recourse.
No.
We can fight with the insurance plan, but there's no recourse, right? Now that I know, I could have went to the attorney general and I could have done all these kinds of things, but in reality, like it gets caught up in government bureaucracy, and in reality, you don't have any rights, as somebody who is signed up for insurance, because they don't really have to fulfill their contract, from my perspective.
And anyone that's, a layperson that has no knowledge of how the inner workings of the medical insurance company system, referrals process, appeals, even trying to do that works. It gets to the point where you try, and it's so frustrating that,
well, right.
People just want to give
up. The problem is that we're taking something that's unbelievably basic and we're complicating it because we're trying to save money, which doesn't make any sense. So let's take healthcare and build a metaphor with, mechanics, getting your car fixed. Okay. So my wife has a German car, much to my chagrin, but she's loved it and it's been fine. It's expensive to fix. So, we went to the one dealership, or not dealership, to the freestanding mechanic, and, they're fixing Lambos and like all of these exotic European cars. Well, guess what? They're 50 or 60% higher than the guy that just, down the street that does just Mercedes. But I'm the consumer. It's on me. I can ask them how much they charge per hour. I can ask for a bid. Mm-hmm. I can go someplace else. That's actual capitalism. But when healthcare, we don't do that. We say, no, you have to go to the most expensive guy. And oh, by the way, you can't just go book an appointment with him. We're going to make you give money to another multinational corporation that's then going to fund you going there. And we're going to decide whether we pay for it or not based on 35 pages of contractual obligation that you as a layperson, what you're going to get a different contract? No, you're forced to sign it. Most healthcare comes through your employer. You either take it or you leave it, and you have nothing. This is literally like the mob running the streets of New York at the turn of the last century. It's like you pay up your extortion money, or, guess what? Your pharmacy gets burnt down. I mean, that's literally how this is working.
Yeah, well, it's not even 35 pages. I mean, Blue Cross Blue Shield of Texas is 104 pages. And if you read through that, you would probably die within the first 3 pages because you have no idea what they're talking about. I mean, it's legal jargon that there is no way for even me, the CEO of a healthcare company, can understand. And so, it's a tragedy in the United States to have something like this operate. And, that's what we're all about to hopefully change it.
Well, exactly. And it's like I was interviewed by Cheryl Atkinson a little while ago, and I told her, I said, the healthcare system isn't broken. It works perfect for the people that get paid through the healthcare system.
Mm-hmm.
I mean, massive hospital systems, the system works pretty good for them. Insurance companies, it works amazing for them. It works amazing for big pharma. It works great if you're an orthopedic surgeon and own a surgery center. System's working great for those people. It's just the people that it's supposed to serve. Those are the ones that are getting screwed. Like when you look at United Healthcare is the biggest for-profit health entity in the world. And it was trading at what, like 40 or 50 bucks at the beginning of Obamacare. Now it's trading for what, like 700. And it was supposed to bring costs down by giving everyone insurance. Are you kidding? It is the Affordable Care Act has ballooned costs beyond the imagination of avarice. It's just crazy because the system is working the way the system is designed to work, which is to line the pockets of the billionaires.
Well, people don't realize that the revenue of United, Cigna, Aetna, and Humana combined is larger than the U.S. defense budget. Just those 4 companies,
right? And they do, they provide no service.
My mind.
I know.
Yeah, mind.
And they're a middle. But the point is, they're a middleman. Like they don't do surgery. They don't prescribe medications. They don't make medications. They don't build hospitals. They
shuffle the money.
They shuffle the money. That's all they do.
Exactly.
And yet,
well, then only 8% of the medical expenses go to doctors. So people, look at doctors. Oh, doctors make so much money, and da 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 da. And it's like, well, it's only 8%. I mean, you can cut the doctor's salary in half and get 4% back. Congratulations. Like that's not the problem. The problem is kind of back to what you were talking about before. Is I think the insurance companies want to reduce fraud and waste. And so they're creating 30, 40, maybe even 50% administrative and bureaucracy to save the 5 or 10% of waste and fraud that they're alleviating. And so, it's an incredibly silly, system. And, it's as you said, it's great for the hospital systems and it's great for the insurance companies. I get asked all the time, oh, healthcare is so expensive or so complex. I don't understand it. And I don't understand why the prices go up and all these kinds of things. I was like, look, this is not that difficult. You've got the sellers of healthcare, which are these big hospital systems. They want the price to go up. That's clear. That's capitalism. That's fine. But the problem is you have the buyer of healthcare, these insurance companies, actually wanting the price to go up too. So the fact that you can, in the Affordable Care Act, they have this thing called the medical loss ratio. I'm sure you're familiar with that, but the insurance companies can only have a certain percent that they can use for administrative cost and profit. And that's say it's 15 to 20%, but let's use 15% as the number for easy math. So if your premium is $1,000, the most that the insurance company can get is $150 of your $1,000. Right. And so these are for-profit entities. These are profit and administrative costs, 15%. So to get that $150 to grow 10% to $165, what do they have to do?
Crazy.
Their premiums have to go from $1,000 to $1,100. So in fact, the insurance companies want the price to go up over the intermediate and long term. The buyers of healthcare, the sellers of healthcare want it to go up. And so when you have the buyers and sellers of a product or a service, both wanting the cost to go up, guess what? The cost goes up, and there's no market forces that are playing in this scenario. And that's why we've got, $4.6 trillion worth of healthcare costs in this country, which, by the way, if it were a country, would be the fourth largest GDP in the world, just the United States healthcare system.
Right.
I mean, that's how much of a tragedy this is.
Right. And like I just wrote an article that's going to be released either today or tomorrow. And it's and what has it bought us? We've gotten, fatter, dumber, and sadder.
Yeah.
We haven't, all of the promises.
Yeah.
I compared my favorite TV show when I was a kid was the $6 Million Man. We can rebuild him better, stronger, faster. Well, we have the $4.2 trillion blob, and we're fatter, dumber, sadder. And it's true. Like it'd be one thing if you paid $4.2 trillion and the ads that they have on TV were actually accurate. We were cured of cancer. We all had six-pack abs. We took our Xiaflex and had perfectly straight penises. But it doesn't work that way. It's working. It's working in exactly the opposite. We're getting less healthy and paying more money for it. I mean, again, that's
perfectly straight penises were not on my bingo card today. Just FYI, like I'm not sure I would have.
Welcome to BS Free MD.
Exactly.
We have a whole episode on that drug
just
because it's so completely insane. But
that is insane. Well, so, I mean, to your point, right? We spend about 25 cents of every dollar we spend in healthcare is on folks with diabetes, and the vast majority of those are type 2. So this type 2 diabetes is a lifestyle issue. This is not something that you get at birth. And it's a lifestyle issue that can be and has shown to be able to be reversed. And so, if you crush your body for decades and come down with diabetes, you can become very, very expensive. And so, what can you do to, change that? I mean, it's lifestyle, it's nutrition, it's things that, don't fall within, the medical cost, but, if you look at the OECD countries, which is like 35 or 36 countries, we're like 50% more obese than other first world countries. And as a result, we are significantly more expensive. Our lifespan is going down, our chronic disease is going up, and therefore our costs are going up. And so, if we could figure out our lifestyle issues, we wouldn't need a change in healthcare. But unfortunately, the way that we're set up, we have no incentive to improve our lifestyle because someone else is paying for it when we have a chronic condition. So that's one of the big challenges that we have.
Well, nothing drives me more crazy than watching these Jardiance ads where they have these morbidly obese people dancing, and they literally are normalizing obesity. They're not saying change your life. They're saying you can be unhealthy, and we'll help your A1C by making you pee out more sugar. Like, it's really, really disturbing. That's what they want. I mean, this is a fascinating story. May talked to Lily because she used a Lilly migraine drug that really worked well. And they were like, hey, we'd be happy to represent this. We dish on big pharma all the time, but they're still necessary and there's still drugs that really help people. And they explained to her how to the number of hairs on their head they count on the models that they have to represent their drugs. It is Madison Avenue down to the last molecule. So they sit in a boardroom and say, no, we want models that look like people that are going to take our drugs. Yeah. And we don't care if it promotes ill health. Actually, ill health makes us money because we're not selling Jardiance to Joe Rogan. We're selling it to the guy that sits around and drinks soda and eats Cheetos.
Well, while we're talking about the whole individuality, and the disease state, reversible diseases, it's a little different from your model, which we'll get to, but I've always been a little bit cranky about the fact this is back in the day before the massive type 2 diabetes epidemic, but people, I'm like, man, costs of healthcare are going up, and yet somebody can drink their liver away and we're going to get them a new liver and they can get a transplant, or someone can smoke themselves to death and we're paying for all their COPD medications, hospitalizations for recurrent admissions for severe bronchitis, emphysema, pneumonias, and the expense is onerous, but there's no responsibility to make them quit. And now with the diabetes, they're so, it's a tough debate because there's so many factors now that are going into our food. And, you can get into that. We're not going to get into the nitty gritty of, well, really what triggers they'll be. Is it all just you're eating more calories than you're burning off, what, all the other things. But for the most part, yes, it comes down to lifestyle choices. And so if you're burning down your house regularly with scented candles, or your what is it called? The
light bright?
The light. Oh, I was thinking of those wood sticks that used to.
Oh yeah, the wood burning kit.
Wood burning kit by the drapes. Or you're driving your car, speeding recklessly, getting tickets. Your insurance costs go up because you're not being a responsible owner of your product, your either autos or your home.
Can't do that in healthcare.
But in healthcare, we don't do that.
Well, no, and that was always my debate when I'd hear Joe Rogan say, talk about this. He's like, well, we have the fire department and we all pay for that, so we should have at least some baseline healthcare for everybody. And I'm like, sure, Joe, that's fine. But if I burn my house down, I go to jail for arson. If I burn my health down, nothing happens.
No.
So if you want to have, sure, we can have baseline healthcare, but then you got to have baseline responsibility as well. Which
what if you burn your house down because you're an idiot multiple times, and guess what? Nobody's going to cover you.
Nope.
You're right. Or, then now for car insurance, they have these things where you plug it into your car and it shows how good of a driver you are. And then your rates go down based on how good of a driver you are. In reality, what we should put is one of those continuous glucose meters on you. And then I'm going to have your rate based upon what your continuous glucose meter is telling me.
Oh yeah. Well, they collect so much data already, right?
I
your height, your weight, your blood pressure, all your labs, your risk for everything. They have all that information.
Nobody in South Florida has anything that tells anyone how they drive. That is an impossibility.
So tell us, let's get into
the solution.
Yes.
We've bitched about the problem. Now you got to tell us the solution.
So my first question before you talk about what CrowdHealth is the company that you were CEO of before, was it a similar model as CrowdHealth?
Totally different. We were doing remote patient monitoring for people with chronic conditions, funny enough. So we were monitoring blood pressure and blood sugars and weight and things like that directly out of the home, primarily for folks with in Medicare Advantage plans. So my customer was health insurance plans, funny enough. So, if you have congestive heart failure and you gain 3 pounds overnight, then we know that, you need to get on a diuretic and get some of that stuff out. And we know that you probably ate something or did something that inflamed that. And so what we would do is we would keep track of all this data. And if something went out of whack, we would call you and say, hey, what's going on? You need to take your meds. You need to go to do those things so that you wouldn't go into the hospital. Right. So that's what I was doing before.
Yes.
Interesting.
Okay. So CrowdHealth, walk us through how it works and the whole logistics of getting people into that.
Yeah. As I mentioned, when I became uninsured, I started, trying to figure out how to do this on my own. And I learned a couple of things that were instrumental in me developing CrowdHealth. One is I realized that when I paid in cash for my services, I was paying a lot less than what health insurance plans were paying. So my wife would go to the pediatrician and would say, hey, we're just paying in cash. And they're like, oh, well, great. We're going to give you a 30, 40, 50% discount if you pay us in cash. And so I kind of started doing some work and was like, okay, so why is this? And it was, the pediatrician gets paid at the point of care in cash. They don't have to bill the health insurance plans. There was a survey that just came out that says doctors who bill insurance spend 15 and a half hours every week dealing with health insurance, the administrative components of health insurance. And so they're spending, a day and a half or 2 days or whatever, with just battling health insurance companies. And so they loved it when we came in and said, we're paying in cash. Because they get a credit card, they pay a 2% transaction fee or whatever it is on that, and they get their money immediately. So I started realizing that if you can pay in cash, then you're going to get way better rates. So how do we allow them to do that? That was one of my first questions. The second thing I realized, and I put this on Twitter, and I was telling people my story about my daughter. I was having people reach out. I was like, oh, do you know you can negotiate that with the hospital? You didn't have to pay that $8,000. You can negotiate that down. And so my guess is I could have negotiated it down to $2,000 or $3,000. I also had some ear, nose, and throat docs who were reaching out and say, oh, yeah, we do these things in office all day long for $1,500. Yep. And so I was like, hold on a second. I just paid $8,000 because my health insurance required me to go to the most expensive place in town where I could have paid $1,500 and, saved just a ton of money. And so I started learning these things, and I was like, man, if we can enable people to viably pay for large and small healthcare bills in cash at the point of care, there's a tremendous amount of savings here. And if there's a tremendous amount of savings, then you don't have to do networks. You don't have to do all these pre-negotiated, rates with networks. And in fact, that probably increases the price as opposed to decrease the price. So what we built is a community of people. We're up to 10,000 people now who, if you have a big health event, let's just say that, I break my arm and it's $5,000. I will pay the first $500 of that because I want to make sure that our members have some skin in the game. CrowdHealth will go to 45 other people and say, hey, Andy in Austin broke his arm. Will you give him $100? And they can say yes or no. And if they say yes, then $100 goes from them to me. And at the end of the day, I've got $5,000 that I can now go pay for my procedure or, my services or whatever in cash. And I'm getting significantly lower rates. And it has kind of ended up being about 50% lower than, what these big health insurance plans are paying if you pay in cash. And so then the question is like, okay, so why would somebody in Arizona who doesn't know Andy, help Andy with the broken arm? Well, when I ask, I let them know the last 10 times that I've been asked, what have I said to people? So if I've said no to people in the community, then I've not been a very good member of the community. If I've said yes to other people, then I've been a great member of the community. So I kind of have a reputation score. How good of a member am I in the community? And what we have found is that good members of the community, almost all the time, actually 100% of the time thus far, have gotten their bills paid. Bad members of the community, only about 10% of the time they've gotten their bills paid. So there's a reciprocity engine that's driving this that has been very, very effective. And we've done this now for over 20,000 bills, $10 million worth of healthcare costs. And it has been incredibly effective in getting, small virtual pediatric bills that are $69 all the way up to, massive injuries. We just had a guy, accidentally shoot himself, one bullet, 6 holes. And, had to get medevaced out from the middle of a creek in Montana. And so, small bills and large bills were able to get funded through this way. And there's no middleman. So it is a peer-to-peer transaction where your money will go directly to me. CrowdHealth doesn't get into the middle of it. And we provide some of the financial technology in the back to enable that to happen. But it is truly peer-to-peer. So, every month, me and my family, I pay $55 per person per month to CrowdHealth. That goes to pay the bills. And then they ask me for another $420, up to $420 a month to help somebody else directly. So I will get an email once a month. It says, XYZ person has uterine cancer. Would you be willing to help them? I can auto set it to say yes to everything, or I can go in and manually and say yes or no. And if I say yes, then my $420 goes directly to that person with uterine cancer, and I'm done for the month. So I only get asked once a month. It's super easy. And I love the fact that my money is going to someone who's struggling with something, as opposed to me sending it to United Healthcare or Cigna or Aetna or whoever. And I have no idea, what they're using it for. It's very, very cool to be able to pay, somebody else, give somebody else, to help them with their health event. So it's worked extremely well.
No, well, there's the kind of even the spiritual side of that, like the idea that you're actually giving to a person with a name that if you wanted to pray for, if you believe that would be great. If you wanted to send a card or whatever, or well wish, or however it works. I mean, it's just the humanity, because so much of what's going on, especially on the financial side of big healthcare, is so dehumanizing. And you're not just paying people's bills, you're rehumanizing the financial side of healthcare, which is the part that drives people the most bananas.
Well, our tagline is fund humans, not health insurance. That's ultimately what we're doing. And I'll just give you a quick story, which I think highlights this. Lots of people in their 30s are part of CrowdHealth. So we have lots of babies, and unfortunately that means lots of miscarriages and things like that. So, we have women who have miscarriages. We send it out to our community, and all the time people will come back and be like, man, I've had a miscarriage I know what that's like. I know the pain that they're going through. I want to help. Instead of $100, can I give $200? Like, and you never in a million years would call United Healthcare and be like, "Can I give you more money this month?" But what we're trying to do is it is a spiritual thing for me. It's a love your neighbor type of healthcare where you are loving another person by giving to them generously and voluntarily, to help them with their healthcare cost. And me personally, I truly try to do my best in loving our neighbor. But what has happened in healthcare, and I think in society in general, is we have all these middlemen, either the government or a health insurance plan, saying, no, Andy, you don't have to love your neighbor because we'll take care of it. Right. And so in essence, what the government is and insurance companies are doing is they're stealing my ability to be generous.
Yes.
I say this often where, like, your next door neighbor moves in, in 20, 30, 40 years ago, and it still happens in some parts of the country. What would you do? You would bake them cookies or whatever. You would bring it over and you say, welcome to the neighborhood. Well, what do we do now? We say, oh, I wonder how much that person bought that house for, because that's the best indicator of how much my house is worth. Right. And we've really lost that love of neighbor component in our society. And so I'm trying to do it on the healthcare side to say, hey, let's love our neighbors really, really well, because this is a community that you want to be a part of. They're taking care of themselves. Their lifestyle is great. But just stuff happens, like you fall off your bike and break your arm, or this guy, was fishing in Montana and he was in bear country. And so he had a gun that fell out of his holster and shot him. Like, stuff happens. Right. Or we have babies. Like, yeah, we all want babies. I'm a populate the planet kind of guy. So like, those are the things that I'm like, I love being able to contribute to that stuff. I don't want to contribute to all this other stuff that's a result of lifestyle, smoking, GLP-1s, diabetes, all these things that I'm like, man, like, that's things that we should take personal responsibility over. So, that's kind of the ethos of our company, is like, let's get a group of people together who all take care of themselves, who are being good citizens of the community. And when they need help, let's all get up and help them. And like I said, so far, 99.8% of the bills that have gotten submitted to the community have gotten funded by the community. The 0.2% that haven't gotten funded are the people who are the takers and not the givers. And so, that's kind of the way that we've operated, and it's resonating with people.
So I have a question about the taker. So is there, and then I'm sure you're going to answer this when you talk about how you get people enrolled and screen based on the people taking care of themselves. But I'm thinking, for instance, say there's a single mom with kids, say, and she's working 2 jobs and she's in this system, but her extra to be able to fund someone else is limited. So if she gets asked to pay all the time, like everyone else, sometimes it's just like she can't. So then she's getting a negative score. And I guess my question is because you mentioned something about a maximum limit per month or ask. I mean, so I'm thinking, so does that mean the people with the most money to give are going to get better scores because they can potentially help 100% of the time because they have a bigger wallet than someone who doesn't?
Yeah, I mean, I think one of the key components of this is we think that by doing this in cash, we can be significantly less than any of the other alternatives. And so, for me and my family, it was I think it was $1,300 a month, and then a $16,000 or $18,000 deductible. I can't remember, for Obamacare, for the Obamacare plan this year.
Oh.
And for CrowdHealth, it is, for me and my family, it's about 8,000, or it's 600. It's averaging around $650 a month, so almost exactly half. And I only have to pay the first $500 of any health event prior to the community helping out. So if my daughter breaks her arm falling off her bike, it's $500. If I went to the hospital last year because of a migraine. I thought I was having a stroke. And so I went, and that was a $15,000 bill. I paid the first $500. And so I think what we're doing is actually doing something way more effective for that single mom with 2 kids, or whatever your example was, because if one of those 2 kids, and she's on one of these high deductible health plans, goes to the hospital, she's out $5,000 or $10,000. Whereas for us, you're out $500. as opposed to paying the $1,300, I guess it would be a little less for them since there's only 3 of them instead of 4, but you're paying $650 or $660 a month. And so what we're trying to do is like decrease costs as low as possible because, we want it to be accessible to everybody. And I think CrowdHealth is the most, I know this is kind of like a hot word nowadays, but I think CrowdHealth is the most equitable option out there. You're not stuck in Medicaid where you get all the shitty doctors. You can go to whatever doctor you want. There's no networks. There's none of that. Like, you have access to the best doctors on the planet as a single mom working 2 jobs with 2 kids. And you're paying way less than if you were to go to, some of these other options. So that's ultimately why I wanted to do this, is like, I saw all these people going bankrupt because they didn't have enough money in the bank to pay for the deductible, and the hospital would go after them. Right. So I wanted to be like, it's $500. Everybody can figure out a way to come up with $500.
Right.
That was kind of my.
So you're getting, you were at the ER, $15,000 visit, $500. What about like cancer, chemotherapy, bypass surgery? $500.
Yeah.
And
$500.
the monthly commitment that the people have to pay into, does that include I was mixed up if that's just like the baseline, or does that include the ask from other members, or is that on top of the monthly payments?
Yeah. So in your first question, the answer is yes. So we call a health event a series of procedures, visits, medications that are all associated with one illness or injury or event. So, if you have cancer and you see doctors and you do chemo and you're in the hospital and you're doing all that, that's all in one health event. You just pay the first $500 of that before we submit the rest of the community. So that's your first question.
Right.
The second question was the payment structure. So you're actually billed twice per month. The first time is $55 a month per person, and that comes to CrowdHealth. It's this, it's on the anniversary of when you started. So if you started the first of the month, every first of the month, I'm going to charge you $55 per person. Then we'll ask you a second time for, a single person. I'm asking you up to $140 to help somebody else directly in the community. So you'll get billed twice a month. The first one goes to us. The second one goes to another human being who needs help. Now, the reason I said it's up to $140 is because we will only ask for what the community needs that month. So, for example, last month, we only asked for $110 of that $140. So that remaining $30, you get to keep in your pocket, go get a ribeye, take your, wife or daughter out, whatever, out to dinner, whatever you want to do with it. But you get to keep it. And so that's the cool part of this, is if the community does really, really well, then the community members are the ones who are benefiting, not a health insurance company. Right. So that's the difference in our model. So we've only asked for that max 140 or it's, 420 for a family of 4 or more 3 times in 3 years. And that's because we had a bunch of NICU babies, or we had this gunshot wound, or we had, some of those big cancer cases that kind of are big. And so we flex up to that 140. But then once we get through the community paying that, then we drop back down to whatever the community needs in that month. So we say, hey, budget 140 if you're single, 420 if you're a family of 4 or more. And if it's less than that, then hey, let's party, right? That's the way that we ask people to think about it.
So does that include my thing is, when you're scoring people based on people that say no, I'm not paying this month. The person, there's a couple of people. Is that paying that 140 a month?
Paying 140, yeah. If they don't pay that 140 a month, then we will let others know about that. Okay, and then you only turn red if you give less than 90% of the time. So, 1 out of every 10 times you can say no. If you have a hard month or something like that, you can say no. But most of the time it's like, look, I can't have everybody just say no because it wouldn't work. So this has been a very effective way of doing it.
Wow.
So do you screen out people with pre-existing conditions?
We don't screen them out. We say, look, so let me tell you how we started. And this is kind of, the entrepreneurial journey, right? We started and we had a bunch of people who jumped in, needed a hip replacement, got the community to fund it, and then bailed out. And we're like, look, we can't do this. Like that doesn't work. And so in essence, what we tell people is like, hey, if you want to be a part of the community, you got to be a part of the community. And that means you have to own your own, what I kind of call health debt, for the first 2 years. And then after that, the community will help out. So we've had lots of people who joined, and after 2 years have said, I do need that hip replacement. And they're like, great, you've been a member of the community, come on in. We'll happy to help you with that. We've had a bunch of people with type 1 diabetes, actually, who have come in and said, I'm saving so much money on CrowdHealth, and CrowdHealth can give me way better prices on my insulin and supplies and things, that I'm just going to jump in and, stick around to be a part of the community. And we're like, great, come on in. We're happy to have you. So, that's just what we had to do to make this work and make it, equitable for the people in the community. And the only thing we screen out for are smokers. So if you're a smoker, you're no good. And if it's obesity, then no good. So those are the two screens that we have.
And how do you screen? Do you get previous medical records? Do you have someone come out and do, the traveling home data screen type situation? How does it work when someone signs up? So say tomorrow, I want to sign up for CrowdHealth. What happens?
Yeah, so the screen on that is, it's most like it's more post-mortem. It's like, hey, if you've had a health issue, you submit it to us. For the big ones, we pull all the medical records just to make sure it's not pre-existing condition. But guess what? If you have been a smoker or you're obese, it shows up in your medical records. And so, we don't go out there and, sniff your clothes to make sure you're not a smoker, or, make you step on a weight scale. We just say, look, if you've got a big health event and we find out you're actually obese or you're a smoker, then we're not submitting it to the community. So you can take the risk if you want, but, we're just telling you, what we will or will not do. So, I think the vast majority of people don't try to play that game. And again, maybe 5% do or something like that, but I'm not going to put in a bunch of, rules and regulations, things around that to make it, to solve for the 5%.
And then pre-existing conditions, there's no, and I won't name names of other companies that are close to kind of what you're doing, but they will often limit those so that, for instance, if someone has an autoimmune disease, rheumatoid arthritis, lupus, whatever, it's like, well, if you've already got that disease, then that can't be included going forward in what the community covers because it's a pre-existing condition. Do you have any limits on those?
Only for the first 2 years. Thereafter, if you have RA and you're with us for two years, then that is absolutely eligible for funding after year 2.
So I get a little sticky on obesity because if you do use a BMI, Joe Rogan is obese.
Yeah.
Yeah, we make exceptions, and we say, listen, if you're close and you're 6'6", 250. 260, whatever, then we'll make exceptions. So we do make exceptions to the BMI rules.
Is there any?
Because I have managed
BMI is a terrible metric.
Yeah.
Well, yeah, no, because I've managed to run, skydive, and ski myself down a couple inches over the last 60 years.
Do you have any cap out? So say someone's got a family of 10 kids. Does it still?
The Waltons.
Does the price cap out on a price limit per family, or no? You still keep at
it? It's so 4+ all have the same giving rate, so it's $420, but you are paying $55 a month per person. So that so that family would be 55 times 10, or I guess 12 if you have parents. I'm not good enough at math to figure out what that is, but you have that. So actually, what would that be? 660 or something like that. Plus 420. So you're sitting at 1,080 for a family of 12.
Yes.
Cheap. I met a guy last week. So he must not be on Medicare. This guy is very wealthy. And he told me for disaster coverage, he's paying $30,000 a year, and his deductible $17,000. And I looked at him and I said, "Why don't you go bare? Why don't you?" This was right after I listened to your episode with Dr.
Absolutely.
Paul. And I just said, "Dude, you're rich as hell. Why don't you just go bare? Just self-insure. Why
waste? You're
he probably
paying money.
should.
Yes, You're giving money away.
Or he needs to join CrowdHealth and join us.
Exactly. So how many years has CrowdHealth been going, and is there any chance of it going upside down so people are then stuck looking elsewhere?
It's a good question. So we started in April of 21. We spent the first 6 months getting the infrastructure ready. We launched in October of 21. So we are a little over 3 years. We've signed up 10,000 people, as I've mentioned, $10 million worth of bills. And we had profitability for the first time over the summer. And so, we're profitable. We have plenty of cash in the bank. And so it's, I have my family, I'm eating what I'm selling. So, I think the probability of that is incredibly low. And I would, for sure, given my just reputation, make sure that people were set if that were to ever to happen. So that the probability of that is extremely low at this point.
Yeah, but it's fascinating because if you big picture this and you assume, let's say 20% of the people in the United States decided to do something like this, it would radically alter healthcare. Because
for sure.
So my new PCP that I'm trying out here next week, I specifically sought out a physician that only took cash. Like, I'm not dealing with insurance companies for a whole bunch of reasons.
And I've done this primary care or something else. Yeah,
for primary care. I've done this for several years because I consume virtually zero primary care, and so like I don't want my health information in a system like Epic. Well, I want control over what I do and who I see, and the way you do that is with money. With that direct producer and consumer relationship without all this other nonsense in between. And
it only makes sense. So to jump on that point, I have a PCP that's in network in the system. We have a super high deductible. It is like, I should remember, 10, 15,000 per year. So I go, and I could go less visits per year than Tim. And the bill is, $500 for the first established care, $650. And then my out-of-pocket cost is, say $450 for the first one or whatever the percentages are. And then whatever after, I'm still paying, I'm using my insurance and still paying more out of my own pocket. Yeah. And he is going to the direct primary care and paying cash and skipping the whole
and not even getting a membership where I would get a discount. I'm just going to pay. Right. And if there's other services I want there, like IVs and whatever, I might join as a member. I might not. Like, it doesn't matter. It's just money. Right.
So in CrowdHealth, then, is there any way? So for instance, someone has a big event and we were talking about ways to bring down the costs for hospitals. You can negotiate the bill down or find other outpatient, a lot of surgeons, yes, they have their own surgery centers or they do stuff outpatient, is way less than going in. Is that up to the patients then to kind of figure that out and negotiate their way down and ultimately then here's the final bill? Or does the company offer some intermediary sort of help, solutions, ideas to get the cost down?
Yeah, great question. One of the things I hated about my interaction with the health insurance plans is when I called in and I had a problem, I'd be sent to, a call center in India or something. And they would try to work through it and then they would have to punt it to somebody else, or I had to talk about my situation again. And I was like, I don't want a call center. I don't want to do that. So what we did is we set up a care advocacy group. So when you sign up, you will be assigned to a specific care advocate who will help you on any of your events. So he or she gets to know you, gets to know your family, gets to know your health conditions, whatever you're going through. And so if something big happens, you can say, look, I tore my ACL, what should I do? And the care advocate's going to be like, great, we've got an amazing, orthopedic surgeon in wherever you are, Austin, Texas. And we know that he or she will, take significantly less if we pay in cash. And and actually, a specific example, we had a woman tear her ACL. And so she went to the hospital. The hospital tries to pawn them off on, their hospital system orthopedic surgeon. That was going to be, I think, $24,000 or $25,000 to do the ACL repair. She calls us. She's like, I'm so sorry. I tore my ACL. And we're like, look, we know this doctor in town who does a bunch of the joint work for University of Texas Athletics. He's really, really good. He does it at a surgery center. And he'll do it for, I think it was 11 or 12,000. So just by, doing that, we saved, the community 50%. So that was a long-winded way of basically saying, look, for any of the big ones, like just call us and we'll help you find a really great doctor. Or if you have a really great doctor, we will call and negotiate on your behalf. For ER bills, which are a little bit different, which you're not, calling us on the way to the hospital, you go to the ER and you just say, hey, I'm a cash pay. And so what they will then do is they'll send you the bills afterwards. You go to our app, you take a picture of the bill, we consolidate them on the back end, and then we actually have a team of attorneys who will negotiate on your behalf with these hospitals. I mean, the other day we got one that was like $325,000 ER hospital bill. I mean, it started ER and turned it into an extended stay, and I think we got it down to like 45 or 50 or something like that. I mean, it was a significant reduction as just a result of our attorneys doing what they do, which is negotiate with these hospitals. So again, another long-winded way of saying sorry. We're your ally. When you get hurt and you're with insurance, what do you say? I have to fight with my insurance company to get this paid. When you're with CrowdHealth, what do you say? It's like, man, at least I have somebody on my team who's going to fight for me to get this stuff paid, right? And it's totally changing that dynamic. And so we help you. We want to be, on call for you. And so I think, if you go to CrowdHealth reviews on Google and look up our reviews, like they are spectacular because people feel like they've got somebody who's trying to help them navigate, an otherwise very, very complex system. So that's how we operate.
I love it, especially your, analogy about the girl with the ACL, because a lot of time people don't know. They're young. You're right. They show up in whoever's on call for the hospital orthopedic rotation that weekend is who you get. Could be a schmuck that's not the greatest. It could be someone spectacular. But if you're like, no, we have an in. When we were working, we get no, I'm not sending you to that on-call doc. I know who you need to see for your knee. It'll be last month. Same scenario. We do that. It works for Austin because you're there. But I'm thinking what about someone's in Portland, Oregon, or pick another place in the Timbuktu, Fargo, North Dakota. Do you have?
There's only drug addicts in Portland, Oregon, so they're not allowed in CrowdHealth.
I mean, are you limited just based on the locations to what you can find for?
I mean, we're all 50 states.
Wow.
We've been being able to provide really great service in all 50. So if we don't know somebody there who's really, really good, we will find somebody.
Perfect.
And typically we will, call other doctors in the area and be like, hey, if you were to send somebody to an orthopedic surgeon, who would you send them to? And the example you just gave was right. Like typically doctors know the other really good doctors in town versus the schmucks. And so, I think quality scores based upon doctor recommendations are probably the best way of doing that. The other thing too we do, which I think is kind of interesting, we will actually ask our members in the area. So, if I live in Austin, 78746, we had another member in 78746 who's looking for a pediatrician. And so what we do is we actually will reach out to the people in that area within, 5 or 10 miles of that. It's like, hey, do you know any pediatrician and XYZ? And like, oh yeah, I love my pediatrician. It's da 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 da. So we're actually crowdsourcing doctors as well. And I felt great because I was able to give them my pediatrician where I felt like I was helping somebody else in the community and I was helping my pediatrician who we love. And so I feel like I'm being valuable, to the community. And so we crowdsource some of those doctor recommendations from either other doctors or our current members in that area. As we grow, with scale, we'll have more and more data points. And so, we will know somebody great in, I'm picking on Des Moines, Iowa or whatever, right? Places where we only have, 50 members there, but, so we may not know the greatest urologist in Des Moines. But we can find you a really great doctor in pretty much any place in the United States.
I love it.
No, this is great. So then I see another couple things. Are you doing any health promotion? Like, can people sign up for like a class or, nutrition? Are you getting into any of the sort of softer, let's be honest, the chronic disease epidemic is largely, it's what goes in our mouth and how much we move our bodies. That stuff is quite easy, I think, to train people to do if they're willing to do it. Do you offer anything like that, or is that you just leave that up to the members?
I do think education is really important. I think we go about it a little bit of a different way where, so for 2025, for example, we've got specials, like quarterly specials, which basically means you can go and get this service and you can submit it 100% to the community to get funded. And so for the Q1 of next year, we're doing a DEXA scan. And we're focusing on visceral fat levels because I think that visceral fat is, a very good proxy for metabolic health. And so what we're doing is say, hey, go get a DEXA scan. You're getting a, muscle mass index on that. You're getting visceral fat. Like, you've got the data now. We're trying to teach you what those things are. How can you improve visceral fat? Why is visceral fat important? Those types of things. So we're trying to educate them on that. Q2, we're doing VO2 max. And so most people don't know what VO2 max is, but we explain that to them and how you can improve it and why it's important and the importance of longevity and things like that. Q3, we're doing coronary artery calcium scores, just seeing if there's calcium around the arteries. Why is that important? What causes that? Those types of things, educate them around that. And then we're doing fasting insulin and LP(a) lab tests for Q4. What are those things? Why are those important? How can you change those? And so we're trying to actually get people data so that they can see, year over year improvements, because I think, what you measure is what matters, right? Or what you measure is the only thing that'll change. And so we're trying to get people in to understand some of these core things that people need to understand, like how does this relate to your overall, primarily metabolic health, which I think is kind of the precursor to much, much worse things if you have poor metabolic health. So we're doing things like that, which I think is more effective.
Cool.
Yeah, I think it's more effective than saying, hey, let's show up to an hour-long class. It's more like, no, you need to be involved. You need to be personally responsible. If you don't want to go get your DEXA scan, then don't get your DEXA scan. You don't have to. But if you want to, then let's do it, and you can learn. And I think that's just a better way of doing it, is actually being hands-on and actually getting data about yourself and understanding what the numbers mean.
That's perfect.
No,
I was just thinking, as you're talking about this, what about other screening, especially things like mammography and colonoscopy screening? Is that pretty much up to the members, or is it the same thing where it's the first 500 is on you, and after that, or how does it work?
First 500 is on you, but mammograms, they're a couple $100 now.
Yeah.
We can find them for a couple $100. It's not that big of a deal. Colonoscopies, we really love helping people with, not because they're a pain in the butt, but because, sorry, bad joke. But because what you can go out and find a colonoscopy for, health insurance plans pay somewhere between $3,000 and $5,000 for colonoscopies. Pretty much anywhere in the country, 90+% of the country, we can find them for somewhere between $1,000 and $1,200.
Mm-hmm.
And so you can submit those. You own the first $500 of that. You can submit the rest to the community. But those are ones where we can get that for way cheaper than if you go and try to find it on yourself, because we know people, who in all these cities, gastroenterologists, that will do it for, I actually got mine 2 years ago for $800. So
you could go down to Costa Rica. My dad got his down there when he's visiting his sister, and I'm like, let's just charter a plane, okay? And then we can take everybody down there, and we can get some group rates on colonoscopies, dental work. I don't know, Botox.
No, but but it's fascinating. My brother was he's retired now, but he was primary care doc for a bazillion years. And he had all these patients coming back from Tijuana that had, because we used to live on the West Coast, that had gastric bypass done.
Yeah.
And so he did the cost analysis of how much it cost to go down there, have a guy that doesn't do 10 of these procedures, a year, somebody that does, 10 or 12
10
of them a day,
yes.
Right? Yeah. So, and a 5-star resort, blah, 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 you pay your $2,000 or $3,000 or whatever, you're done. And then you track over a year. So how much do they save on not having to take diabetic meds and hypertensive, all this. And it was amazing. It was staggeringly cheaper to just send every single morbidly obese patient to Tijuana than it was to just see them in the healthcare system and not even do a gastric bypass here or a gastric sleeve here. Just send them to Mexico, which tells you everything you need to know. Plus, the guy in Mexico is making millions of dollars a year because he's unfettered with the regulations and the hospital systems. And he's free to just do as many as he wants.
Let me tell you just a real quick story, because we had a member up in Wisconsin who was working out, and his heart rate went up to like 230, I think, something like that. And so he goes to the ER, he gets in, you probably already know what it is. There's like supraventricular tachycardia, and so you've got to get this figured out. And he's like, great news, we can do it here. It's $86,000. And he calls us, he's like, guys, again, I'm sorry, 86 grand. Wisconsin is one of the most expensive places to provide healthcare on the planet, by the way. So you're like, hey, look, can we just look around for you and see what else we can find? And he's like, yeah, for sure. So we found a guy in an academic medical center in downtown Chicago, 90 miles away, that was going to do it. That would be willing to do it for $44,000. So 90 miles. We already cut it in half. We kept looking. There's a guy in Oklahoma City that does almost more of these than anybody else in the country, who's willing to do it for 22. And so we call him up and we said, dude, if I give you 2 first-class tickets, you and your wife fly down to Oklahoma City, we'll put you up in the penthouse suite of the nicest hotel in Oklahoma City. It is Oklahoma City, so it wasn't that expensive, but we will pay you for your time. Would you be willing to do it? And he's like, sure. So he flies down to Oklahoma City. We shuttle a CrowdHealth advocate up there, picks him up in a Mercedes, drives around for the entire 3 days that he was there. And I think that all in cost for that was something like $28,000 versus $86,000, that 1,000 miles away. So you're saving more than $50,000 by going 1,000 miles. Right. So some of these things happen in the United States too, where you just are in a bad part of the country. And we don't ask people to do that all the time. But like, if there's a massive change and we're like, look, we'll compensate you for going and doing this because it makes sense. It makes economic sense. And this couple is our biggest fan. They're our biggest fans. Like, they're like, we felt like we were king and queen for 3 or 4 days.
I love it.
Through like one of the hardest moments of our life, a heart procedure,
right?
And it's not super invasive and things like that. It's not that hard of a procedure, but they felt like they were on top of the world because we helped them and loved them really, really well.
I'm sure. I can only imagine.
So
wow.
if I signed up tomorrow, 59-year-old male, so I'm a little ways from Medicare, but this makes me want to not even get Medicare. But that's Medicare. Besides the point. So I gotta, before I can draw out, I have to be
2 years in.
2 years in. But I'm assuming that as I'm paying in for my 2 years, I'm still getting the negotiations and all the other services that you.
Yeah.
I just can't draw from the community pool.
You said pre-existing. So if a new event happened, like gets hit by a car in 3 months.
You're those are all eligible.
Oh.
If you join today and you get, God forbid, cancer tomorrow, then that is absolutely eligible. It's only for the things that have happened in your life for the last 5 years.
Where's my computer?
Pre-existing.
I'm signing up now.
Right. So if you had cancer 2 years ago,
right,
and you join and have, and it recurs tomorrow, then that's not eligible. If you had cancer 10 years ago and something pops up, then it is eligible, because we only do a 5-year look back.
Okay. So I don't have heart disease. But let's say I do another one of these shows and I start ranting like crazy and have a heart attack.
Right.
Assuming I've already joined up.
It's eligible.
That's eligible.
Yippee.
Yeah.
Okay. So how do people sign up?
Joincrowdhealth.com. It's super easy. It takes between 5 and 10 minutes to sign up. You can sign up whenever you want. You can quit whenever you want. It's a month to month. So we don't have open enrollments or any of that craziness. And if you use the promo code BSFree, we'll give it to you for $99 a month for the first 3 months. So that includes your fee and your contribution. So $99 total, nothing more than that for the first 3 months. And what we tell people is like, look, it's $99 a month. Come in, try it. If you like it, awesome. Stick with us. If you don't, then that's fine too. But it's a $99 investment. my family saved about $15,000 last year. Most of our families are saving 10. Our individuals are saving 3 or 4. So it's worth the investment just to see if it works for you. And again, go to Google, type in reviews for CrowdHealth, Trustpilot. We've got like 350 reviews, and these people are leaving like paragraphs, of reviews, being like how great this is. And then you go to Aetna or Cigna, or United Health, and then look at theirs, and then do a comparison. Because I think we'll beat them. I know we'll beat them. So, join crowdhealth.com.
Join crowd. I can't say that enough times. Join crowdhealth.com. Did you see the news today?
And type in PS free.
I know. I saw the news today. It's
the
horrible.
CEO of United Healthcare was assassinated outside of a Hilton hotel in New York City. Unbelievable. That is.
It's not the way. I don't like. I said on LinkedIn today. I don't like United Healthcare. I despise United Healthcare. However, this is not the way.
No.
This is not the way.
Well, absolutely not.
It's a tragedy.
No.
It's such a tragedy.
Wow. Is there any? Man, I have still one last question before we wrap. Do people get to 65 Medicare age and then opt out, or is there still a benefit to continuing on with the CrowdHealth based on what instead of buying all the supplements?
Well, yeah. So we're working on Medicare. There's a regulatory issue currently that I'm working on. So, I would say with a decently high probability that we'll have something for people Medicare age within the next 12 to maybe 18 months. And candidly, a lot of it has to do with this administration or this upcoming administration and what they're going to do and some of the regulatory things there. And so we would love to do it. It's just hard to do given current regulatory environment.
Right.
Yeah, no, and it's very regulated. And if people actually understood Medicare Advantage, they would recognize that it is the world's biggest ripoff.
Yeah.
It's like, okay, now you're on Medicare and we're going to fleece the living hell out of you now too. Yippee. Because you're old and sick and scared of going to the hospital. So we're going to, it is, when I was working in the health insurance side of the world, the CEO of our organization, he was like drool dripping down the side of his mouth every time he talked about their Medicare Advantage plan, because these health insurance companies make so much money.
They crush it.
Medicare Advantage, because they're double dipping. They're getting money from the patient and they're getting guaranteed money from the federal government. It is, it's nauseating, actually.
Amen.
Well, Andy,
that's our next show. Let's talk about Medicare Advantage next show, right?
Yeah, I'd love to do an entire show on Medicare Advantage. We live in a largely retirement community now. Our neighbors' heads will be exploding.
Exactly. So, crowdhealth.com, pretty simple.
Join crowdhealth.com.
Join crowdhealth.com. We wanted crowdhealth.com, but the guy wouldn't sell it to me for less than $1 million. I said, go pound sand.
What's he going to do with it?
I have no idea.
I own covidlawyer.co. So, and I bought it in like 2021 because I knew it was all bullshit and it was all going to blow up. So I'm hoping some Morgan & Morgan firm gives me like $1 million for it.
Sure. Keep hoping. All right. Thank you so much for your time. That was so informational. I'm like, how it just seems like it sells itself. Like how
this is inspiring.
It's totally inspiring. For people of all ages, it just sounds like the perfect,
well, just think if everybody did it, you would crush the industry.
Yes, I was going to say
amazing.
the perfect solution to what we got. But one of the most amazing solutions, honestly, to dealing with health insurance, we're all for direct primary care and, what? Oh, sorry.
By the way, that direct primary care, you get one wellness visit every year, up to $300 that you can submit to the crowd that doesn't have that $500 hurdle. So if you're in direct primary care, you can submit up to $300 worth of direct primary care fees per person to the community to fund. So, we do that because we want you to do your preventative stuff. And so that is the thing that doesn't have the $500, minimum. So if you want to go to your OBGYN or your pediatrician or your primary care doc or your direct primary care, or if you just want to get a full set of labs, you can do that once per year and submit all of that to the community for funding up to $300.
Okay.
This is great. This is way better than what I thought. I'm glad we had a little bit more than an hour to dig a little deeper into this, because this is just, it's so nice to talk about solutions. It's really easy to sit there and curse the darkness and bitch about how terrible stuff is, but this is a novel solution. If this really caught fire, it would absolutely revolutionize how we pay for healthcare. Not even a question.
I wish we had thought
I appreciate that.
And so we thank you for getting the ball rolling on this, because it's amazing. And it just takes a little bit of someone's tragic circumstances with your daughter's ENT issue to light the fire and really create a movement that really can change, affects people's lives literally. And so, love it. Thanks again. And yes, we will. I think we'll be having lots of friends, family, and so forth.
Have them sign up.
You bet. Absolutely.
I would love that. Thank you guys for having me. It's been fun.
It's no secret that medicine is a bit uptight. That's why Tim and I created BS Free MD, to mix things up a little and have fun in the process. Besides, we are having these exact same discussions all the time, so we thought we might as well invite everyone to the party. If you really like us, you can get plenty more and maybe see one of Tim's cool tattoos on our Instagram or Facebook pages at BS Free MD. See you next time.
While we try to keep BS Free MD as raw and real as possible, we can't be held responsible for any medical decisions or discussions had as a result of what you've heard on the show. We know, bummer. But the truth is, we really do care about your questions. So feel free to reach out to us by email at doc@bsfreemd.com.